Good afternoon. We're here again at the Slatington Library doing our monthly diabetes talk. I'm Ed Bechtel from Bechtel's Pharmacy. And we have a guest speaker this afternoon. Erin Fegley is in her final year at the Philadelphia College of Pharmacy at the University of Sciences in Philadelphia, and she's going to talk to us today about insulin.
Hello everyone. Like Ed said, today, I'm going to talk about insulin today, and my name is Erin. So to start off, I want to talk about the two types of diabetes. For type 1 diabetes, most people make little to no insulin, and they are known as insulin dependent, meaning that they need an outside source of insulin. Whereas type 2 diabetes is when they still make some insulin, but not enough in response to the amount of sugar in the blood. And in some cases, it is possible that their body no longer makes insulin, and they may need insulin to supplement that. Neither type of diabetes is worse than the other, but you may get diabetes in different ways, but both types of diabetes cause harm to the body in a similar manner. This slide shows the blood sugar goals. Before breakfast, also known as fasting blood glucose, it should be between 70 and 130 milligrams per deciliter. And 2 hours after meals or postprandial glucose, it should be less than 180 milligrams per deciliter. This is the three-legged stool approach, and the three legs of the stool represent healthy eating, exercise, and medications. You'll notice that two of these legs, diet and exercise, are controlled by you. Each leg of the stool is just as important as the other. So what is insulin? Insulin is a hormone that's produced by your pancreas. When you eat, the cells of the pancreas release insulin to help you use and store glucose in your muscles, fatty tissue, and liver. Did you know that prior to the 1980s, insulin came from the pancreas of pigs and cows? This was a certain problem for people allergic to animals. Now, all insulin available in the United States is manufactured in a lab. This is known as synthetically derived insulin. Most diabetics are maintained well using synthetic insulin. It is used to manage both type 1 and type 2 diabetes. In type 1 diabetes, your pancreas does not make insulin. You need insulin injections in order to use and store the glucose from your food. You may start out with 2 injections daily using 2 types of insulin, which we'll talk about in a few minutes. You will then progress up to 3 to 4 injections daily. This seems to provide the best control and helps prevent or delay eye, kidney, and nerve damage caused by diabetes. Your healthcare provider will determine what type of insulin you need and how often you need injections by following your glucose levels. In the past, type 2 diabetes was known as non-insulin dependent diabetes. This name is no longer used because people with type 2 diabetes may need insulin. People with type 2 diabetes can become insulin resistant or stop responding to the insulin their body makes. Sometimes the pills used to treat your diabetes stop working effectively. In either case, you will need insulin to control your blood glucose. In the beginning, 1 injection in the evening or at bedtime, along with oral medications, can be effective. Over time, you may need to increase to 2 to 4 injections daily to maintain good control. There are 4 important terms you should know about insulin. Educators and healthcare providers will talk about onset, peak, duration, and strength. Onset is the length of time it takes for insulin to reach your bloodstream and begin to work. This can be anywhere from minutes to hours, depending on the type of insulin. Another important term is peak. This is a period of time when insulin is working at its maximum ability to lower your blood glucose. This can range from an hour to 12 hours. Duration is how long the insulin remains active in your body. This can be from 2 to 4 hours or over 24 hours. The final term is strength, and it's very important. This is measured in units per milliliter. Make sure that the special syringes for insulin match your insulin strength. In the United States, U100 or 100 units per ml is most common. Insulin from other countries can be a different strength. Make sure you have plenty of insulin in syringes, especially if you're traveling outside of the United States. There are 4 basic types of insulin, and an additional group labeled premixed. Insulin is classified based on onset, peak, and duration, and they include rapid-acting, short-acting, intermediate-acting, and long-acting. Rapid-acting insulin begins to work in about 5 minutes. It peaks in 1 hour and lasts for 2 to 4 hours. This type of insulin covers what you eat in a meal. It's usually used in addition to a long-acting insulin. Some examples include Humalog or insulin Lispro, Novolog, insulin Aspart, or Apidra, insulin glulicine. Short-acting insulin, otherwise known as regular insulin, is an insulin that begins to work in about 30 minutes. It peaks at 2 to 3 hours and lasts 3 to 6 hours. This insulin covers what is eaten in a meal, but it is given 30 to 60 minutes before you eat. Some examples include Humulin R and Novolin R. Intermediate-acting insulin is usually given with a rapid-acting or regular insulin. It doesn't begin to work for 2 to 4 hours after injection. It peaks at 4 to 12 hours, but it can have a duration of up to 18 hours. Examples of this are NPH and Lente. Long-acting insulin doesn't have a peak level. It starts to work in 6 to 10 hours and can continue to work for 24 hours. It lowers your blood glucose evenly over the 24-hour period. It can be combined with rapid-acting or regular insulin to cover your meals, and it will achieve good management of glucose levels. Some examples of this are Ultralente, Lantus, and Levemir. Finally, premixed insulin combines 2 different types of insulin into one bottle. This is helpful for people that have trouble with vision or dexterity. It is easier when having to draw up insulin from 2 bottles before injecting. This insulin is most often taken twice daily before a meal, and your healthcare provider will determine which combination and strength might work best for you. Insulin must be given by injection. It can't be taken by mouth because it will get broken down in the stomach. It's an important part of managing your diabetes. Most people will become comfortable with giving the injections, especially when they consider all the serious problems related to high blood sugar. Your healthcare provider will look at many different things to determine the medications that work best for you. It is important to know if your pancreas is making insulin and how well your body is responding to insulin. Your lifestyle choices, food, alcohol, exercise are considered. It's also necessary to evaluate your willingness to take injections and how your age, vision, and dexterity affect you. Can you see the labels and syringe markings? Are you physically able to use your hand to draw up and inject insulin? The way you take your insulin is determined by your healthcare provider. While injections with a syringe and pen are most common, pumps are still being used. Nasal insulin was available in the mid-2000s. It was effective, but unfortunately very expensive, and it was removed from the market. However, research has continued and is now being presented to the FDA for approval.
But it was, and they did have it on the market.
Used by what?
Type 2 diabetes.
Instead of you taking a shot, you just
Proper safe and disposal of insulin, syringes, and pen needles is important. Contact your city, county, or private waste removal company and ask about specific regulations in your area. If possible, remove used needles from a syringe before its disposal. It's best to use a device made specifically for this purpose. Never use scissors or pliers to clip needles. You or a loved one could be injured. If you don't remove your needles, recap them. Then put the syringe and needle into a heavy plastic bottle with a screw on top. Be sure that the plastic is heavy enough to prevent a needle from sticking through. Empty detergent bottles work well for this and are much less expensive than purchasing a biohazard container. Don't reuse or recycle your syringe and needle container. The possibility of being stuck with a used or dirty needle is a risk no one wants to take. Insulin is absorbed at different speeds from different sites. It's important to use the same general area, but not the exact spot for each injection. Injecting in different sites in the same general area leads to better control and prevents the formation of hard fatty lumps. Absorption is fastest in the fatty tissue in your abdomen. The fatty tissue in your upper arm is a little slower, and absorption is slowest from the thighs. Timing your insulin injections correctly gives you the best blood sugar control. It prevents hypoglycemia and allows your body to use the insulin effectively. Insulin is most effective when it's beginning to work as the glucose from your food is entering your bloodstream. This is why knowing onset, peak, and duration of your insulin is important. Regular or rapid-acting insulin should be scheduled around your meals. However, long-acting insulin should be given at the same time every day. All diabetics need self-monitoring, even if you don't use insulin. When using insulin, self-monitoring helps to determine if your correct dose and type are working. It's also important to monitor the dosage and sites of insulin injections. As I mentioned before, insulin is absorbed at different rates from different sites, and you need to take this into consideration before your healthcare provider makes any changes. Insulin needs to be stored in the refrigerator, but injecting cold insulin can be painful. Keep your bottles in the refrigerator until you need to open them. Once a bottle is open, you can store it at room temperature for 1 month. Label a bottle with a new expiration date when it's opened. Avoid extreme temperatures like the freezer or direct sunlight. Another thing to avoid is leaving the insulin in a hot car. Always check your insulin bottle before using to make sure there are no clumps, crystals, or discoloration. Insulin can be a scary word to most people with diabetics. If your healthcare provider says you need insulin, give it a try. Monitor your blood glucose closely, along with your meals, dosage, and site. Talk to your pharmacist or healthcare provider about different ways to use insulin and be honest about your concerns. With pens, pumps, syringes, and premixed options available, there's a good choice for you. Remember, managing blood glucose is vital to prevent or delay the complications of diabetes, and insulin is sometimes the only way to achieve good control. And thank you for your attention, and if you have any questions, I will be happy to answer them. Yes?
How do they make some insulins last longer than others?
So, in some insulins, they manufacture it so the insulin molecules are stuck together. So when they get into your body, it takes them longer to dissociate from each other, so it lasts longer in the body.
So that's the lente.
Yeah.
How about the ones that are labeled fast acting as opposed to short acting? Short acting is regular insulin. That's identical to human insulin. How could they make something faster than something that's identical?